All right, it's recording now. I'm on mute.
All right, hello. We are Group 3, and our research topic is hemophilia and gene therapy. Hemophilia is a genetic blood disease and is well known for its connection to the English royal family. In the 17th century, Queen Victoria acquired a disease through spontaneous mutation on both of her X chromosomes, and eventually ended up passing it to her descendants in the royal family. Those who receive the mutated gene will suffer from the effects of hemophilia, which is a reduced clotting factor in the blood. This can lead to profuse bleeding, easy bruising, and a higher risk of internal bleeding. Due to this, small injuries can be very dangerous for hemophiliacs, as they might bleed out from a normally slight injury. It is important to clarify that hemophiliacs do not bleed more, but longer. It reduces the body's ability to clot, but it can still clot, although it will be very thin. So, small cuts and scrapes do not cause a hemophiliac to bleed out. It is when a hemophiliac acquires more severe injuries where they are in trouble. Currently, there are medicines that contain clotting factors that hemophiliacs can take in case of excessive bleeding. People with hemophilia usually have a medical identification bracelet in case of emergency hospitalization, so that doctors know they have the condition and can act accordingly. There are two ways that you can get hemophilia. The first way is the most common method, where the individual's parents pass on the genes to their child. So if the dad has hemophilia, or the mother had it, or was a carrier. However, there is another way that you can get hemophilia, like what happened to Queen Victoria. She had a spontaneous mutation on both of her X chromosomes when she was born, and then later in life passed it to a lot of children. When you have an X chromosome for hemophilia, you'll be affected in three possible ways. If you are a male, then you will get hemophilia because males only have one X chromosome. So that is the only gene that can be expressed. If you are a woman with another normal X gene, you'll become a carrier and will most likely not be affected in any way because the unaffected gene can be expressed. If you are a woman whose X genes both are mutated, however, then you will get hemophilia because the mutated X genes are the only ones that can be expressed.
So there are two types of hemophilia, hemophilia A and B. Hemophilia A affects around 1 in 5,000 male children and is caused by a lack of clotting factor 8, also known as the anti-hemophilic factor. Factor 8 is a protein that plays an important role in the blood clotting cascade, which is represented by the image on the bottom right. It shows how one factor works with another, and if one was to become dysfunctional, the rest leading that factor would be affected. In the case of a functional factor 8, it would stimulate factor 9, activating factor 10, which ultimately coagulates blood, forming blood clots. Since patients with hemophilia A have a dysfunctional factor 8, an accident, whether big or small, would result in excessive bleeding because blood clots wouldn't form fast enough. This is the last part of the clotting process that forms a net that closes a blood vessel. Hemophilia B, on the other hand, is caused by dysfunctional factor 9, which is also known as the Christmas factor. Normally, factor 9 is inactive in the bloodstream until an injury happens. In the case of hemophilia B, the protein is malformed and the inhibitor is persistently attached. This prevents factor 9 from taking part in the blood clotting cascade, leading to similar symptoms as hemophilia A. Hemophilia B, though, is more rare, affecting 1 in every 40,000 male children, while at the same time having more severe symptoms.
When it comes to gene therapy, there are two kinds of gene therapy that can be performed. The first kind is somatic gene therapy, where the change in genetic information is confined to the individual and cannot be passed on to the offspring. This is because the addition of genetic information is done within a somatic cell. Somatic cells are any kind of cell in the body that is not a sex cell. When new genes are added to a somatic cell, the genes will only spread within the individual, but will not distribute into the sex cells. This therapy is usually used to cure diseases in individuals with diseases such as cystic fibrosis or hemophilia. Germline gene therapy is a different kind of therapy that does not benefit the individual as much and is much more helpful for their offspring. This is because germline gene therapy only affects cells that produce sex cells, meaning that the offspring of an individual will inherit and benefit from the effects of the gene therapy. Gene therapy is not very helpful to someone currently suffering from a disease, but can ensure a lower risk for their future generation of children. Within both somatic and germline therapy, there's the option to either perform gene augmentation or gene inhibition. Gene augmentation is where a functional gene is delivered to a cell and allows for the simultaneous expression of the faulty and new functional gene. Since the inserted functional gene is also being expressed, then the cell will be able to restore normal function despite the expression of the faulty gene. Gene inhibition is where a gene is inserted into a cell in order to stop the expression of a faulty gene. This is useful when a gene mutates to express something different than normal and causes problems. In order to restore normal functioning and gene and solve the problems caused by the faulty gene, a blocking gene or inhibitor is inserted into the cell that inhibits the faulty gene and prevents its expression.
So now that we know a little bit more about gene therapy, let's start going into how gene therapy can be used when it comes to hemophilia. So it appears that both somatic and germline gene therapy can be helpful for hemophiliacs. This is because those with hemophilia can benefit from somatic gene therapy, and their offspring can avoid developing the disease through germline gene therapy. When it comes to the application of gene therapy to individuals already suffering from hemophilia, the best method of gene editing can depend on the type of hemophilia that they have. For those with hemophilia A, gene augmentation would be the most useful type of somatic therapy, as it would allow their cells to express a functional copy of the factor VIII gene. This would hypothetically restore normal blood clotting function and allow the previously hemophiliac individual to live life without hemophilia symptoms. However, due to the immune system's response in hemophilia A patients, additional combinatorial treatments are needed, which I will discuss in the next slide. In the case of individuals with hemophilia B, the type of gene therapy that is most useful would be a combination of both gene augmentation and gene inhibition. This is because hemophilia B is caused by the persistent attachment of an inhibitor to the factor IX gene, preventing it from being activated and subsequently activating factor X, finishing the clotting cycle like we learned about earlier. Gene inhibition would allow for the diminished expression of the faulty inhibitor gene, allowing factor IX to function as normal more frequently. In combination with this, gene augmentation would allow the addition of a functional factor IX and functional factor IX inhibitor gene, ensuring that the individual has an adequate proportion of their factor IX molecules functioning as normal in the bloodstream. This would ensure healthy blood clotting behavior and help hemophiliacs to live life without issue. Scientists have used this knowledge already to effectively develop gene therapy for hemophilia B patients, but studies are still underway for the complete and effective treatment of hemophilia A. Currently, human stem cell therapy in combination with gene therapy appears to be the only method of effectively treating hemophilia A. This is because the patient's immune system recognizes the factor VIII protein as an intruder and produces inhibitor antibodies that stop it from functioning, even if the factor VIII transgene is present and being expressed. In order to circumvent this and ensure the adequate concentration of factor VIII in the bloodstream, scientists took bone marrow cells, transformed them into hematopoietic stem cells, and incorporated the factor VIII transgene and the retroviral vector genome into the chromosome of each stem cell. These gene-augmented stem cells were then injected into the liver tissue of the patient. Once present, these stem cells can differentiate appropriately according to the tissue, but also have the benefit of constantly expressing the factor VIII transgene and producing copies of the retroviral vector. These copies of the vector then leave the stem cells and infect other cells, injecting the contents of their capsid into the other cells. These viral capsids contain the factor VIII transgene, and once the retroviruses inject this transgene into a new host, the host cell will incorporate it into their genome and begin producing the correct factor VIII protein. By this method, the cells in the liver are able to produce a sufficient concentration of functional factor VIII within the blood and restore normal clotting function. However, this method has currently only been successful in mice, so it remains to be seen if effective human stem cell gene therapy combination treatments will be effective.
Currently, nowadays, hemophilia treatment is covered under insurance provided by the government and private companies. In the long term, providing treatment and gene therapy for hemophilia patients would be greatly beneficial in reducing its commonness among the population, and less cases will appear in the future. However, given its cost of approximately 2.1 million US dollars for a single dose session, many companies may feel reluctant to help pay for these costs under their insurance benefits, as it comes out from their own wallets, and is seen as an investment into the individual themselves. To the company, this is highly unfavorable, as the affected individual staying with the company, as the affected individual is not guaranteed to stay with the company and can be seen as a monetary loss if they ever leave. Since companies' motives to provide these health benefits are thin, government intervention can step in to help protect workers' benefits and cover some amount of the treatments under that insurance cost. Thank you for your time. Do we have any questions?